Hello and welcome. This is a really exciting / terrifying, both together at the same time without blending the two, a la carte video. This is the holy crap, I'm pregnant video, and I'm so excited that you're here. I'm so excited to share some information with you and make this really intense part of life hopefully a little bit saner, a little bit more balanced, a little bit more big picture. So let's get started. Okay, so here's what we're going to cover in this video. First, we're gonna talk about HCG basics, so that pregnancy test, whether it's at home or a blood draw at a clinic. We're gonna cover the basics that you need to know and what that's gonna tell you. We're also gonna cover how you might be feeling physically, how you might be feeling emotionally, what you might be worried about, spoiler alert, probably everything, and why the big picture matters. The last thing that we're going to cover in this video is another new mantra that will help you keep things in check and keep it very big picture. Let's go. Okay, so HCG is the pregnancy hormone, and where it comes from is when that embryo touches down on your lining, it's going to liquefy and sink in, liquefy and sink in, liquefy and sink in. If you've made it to the nursery module, you will have seen this in a video there. If not, we'll cover it. And basically, as it sinks in, it starts to secrete HCG, which can be picked up in urine and can be picked up on a blood test. Now, people ask me about false positives. If you did an HCG trigger shot and you test really early, that shot might still be in your system, so you can get a false positive there. But if you've waited till the day that you're supposed to be testing, or you haven't done an HCG trigger shot and you get a positive, even if it's faint on a home pregnancy test, that's still hopeful. It's also, all I know is that I don't know turf, so take it one step at a time. But I often say when people get a positive, no matter what it looks like, that it's like the opposite of landing on the moon. It's like one tiny step for mankind, but one giant step for you. So it's really exciting, and just take it step by step. Now, a lot of you are going to be doing actual blood draws where they're going to give you an actual HCG number measurement. And people ask me about this all the time. Does it matter if it's lower or higher? Now, to a point, it does matter. So very, very low, I'd say if it's under 20, that's pretty shaky. If it's over, it has to be pretty darn high for me to get worried about it being too high, like over 1,000. That might be concerning to me, but anywhere in between. Basically, what that first number is telling you is not how viable the pregnancy is, aside from those big extremes. Anything in between, and usually an average range is maybe like 20 to 350 would be an average range there that I see in IVF specifically. But what that tells you is not if it's better or worse, it just tells you how fast that embryo got down to business. So if it was a little bit ahead of schedule, got out of the fallopian tube or got put in your uterus and got right to business implanting, that first HCG draw is going to be a little bit higher. If it was just like, hey, I'm taking my time, I'm getting oriented, I don't want to rush, I'm going to sink in slow, it might be on the lower side. Doesn't mean it's not viable. Again, we don't have the luxury of testing all sorts of people that got pregnant spontaneously, so we don't know how often pregnancies just do this naturally, but we do know there's lots of variation in humans, so we can trust that it's here too. Quick little side note, when you're reading about HCG levels, or you're thinking about how pregnant you are, the day that you would miss your period, or the day that's 9 days past a day 5 blastocyst transfer, day 14 basically after you ovulate or did a retrieval, on the chronological time of that embryo, even though more time might have passed, that is when you are exactly 4 weeks pregnant. So you get bonus 2 weeks, which is great. Take whatever you can get. But that is how it works when you're dating a pregnancy. So the day you take your pregnancy test, the day you miss your period, you are 4 weeks pregnant, and you measure from there. Now let's talk about HCG doubling. So tons of people have heard the idea that your HCG should be doubling every 48 hours. And a lot of clinics will have you come back and retest your HCG once you get a positive and watch for that doubling. The tricky thing is the data is actually a little bit more nuanced than that. So 48 hours is a time that a lot of HCGs will double, but statistically where the tipping point really is between a pregnancy that's more likely to end in a live birth or less likely to end in a live birth is it needs to double within 72 hours. So at that 48-hour mark, it should be going up by at least 2/3, so 66.6. Let's just say for the sake of easy math, you get 100 is your first HCG. Might be higher than a lot of people's, but let's just go with it. So you have 100 to start. If your clinic has you test just 2 days later, then the minimum you're looking for is 167, 66.6% or more better. That number is the tipping point where you are about 85% likely to have a live birth at the end of that pregnancy, which is pretty good. If you've done genetic testing on your embryo, it's higher than that, but those statistics, I'm not aware that anybody has compiled that. That's just with general pregnancies. If your number is going up, but it doesn't hit that tipping point, so maybe it was 100 to start and now it's 150, close to hitting the mark, going up still, but not as right where you want it, then you have about a 15% chance of having a live birth. So it's not over until it's over. You have to repeat that mantra, all I know is that I don't know, and then go in for a third test and give it some time. But it is definitely not completely over at that point. Now, if you do a second test and it's going down, or it's only gone up by 2, that's less hopeful, and I would brace myself for probably that pregnancy not progressing. But in general, if it's going up over 66.6% or more, great. That's as good as it can get at that stage. If it's close to that, sit tight, wait. I had a patient that I worked with who did a transfer, and when she did her beta HCG 2 days later, it had gone up by like 55%. And her clinic called her. She was actually on my table, my acupuncture table, when she got the phone call, and she's like, I have to take this, Nicole. She took the call. They said it hadn't doubled, and so she should stop her hormones. And I was like, hold on a second, let me just do some calculations. It's still going up by quite a bit, and it's just missed it by a hair. And so she was gonna go to a family reunion, and she's like, I'm gonna go and get drunk, Nicole. All of my cousins are pregnant, and I cannot handle this. And I was like, you know, if it were like gone up by 3, I would say go for it in moderation, but it wasn't that. So I was like, I really think you should just stay the course, get another test on Monday. She has a daughter from that cycle, and she was really guarded. She was guarded for a long time. So remember, conditions being what they are, you're going to feel however you feel. So even if you get a positive pregnancy test, if you've had a bunch of losses, you might feel really guarded or not excited or even some dread. That's okay. She felt really guarded because she was told it wasn't probably a good pregnancy until like 18 weeks. And then she started getting excited. So just kind of trust that it is what it is. You have to stay big picture, work on offsetting that stress, and take it one step at a time. All right, so let's move on to how you might be feeling physically. It's a little bit more simple than the emotional side, a little bit. So the first thing is, all I know is that I don't know. If I were to divide out all the people that I've seen over the last 15 plus years, and I would say, okay, you found out you were pregnant, did your boobs hurt or not? It would be totally split. If I said, did you feel really tired or not? It would be totally split. Did you feel different or not? It would be totally split. Did you feel like you were gonna get your period? It would be totally split. Did you have cramping or not? Totally split. So the mantra here is, all I know is that I don't know. And the truth is, it's different from body to body, but it's even different in the same body from pregnancy to pregnancy. I had a person who I've worked with through her 2 daughters. She was doing her 3rd cycle, and she was like, I know that this one didn't work. I felt different with the first 2. This one I didn't. I'm just ready for it. What are the odds that I'd have 3 cycles of IVF in a row that would work? So I guess this is my time that it's not going to work. And I was like, it's different every time, even in the same body. And she's like, no, Nicole, I know that I'm not pregnant. She was pregnant with twins. Her single embryo transfer split. So just know that even if you really, really, really think that you know, you should use the mantra, all I know is that I don't know, because there's no magic sign that means for sure you're pregnant and gonna stay pregnant. There's no magic sign that means that you're not pregnant or you're not gonna stay pregnant. So just keep on offsetting. And one of the things that I'll have people do is let whatever thought about your physical symptoms that is playing in your head be that bell of awareness, right? So if the thought is, I don't feel different, then that's your little gong that you can switch that to, that's my reminder to breathe, or that's my reminder to say, all I know is that I don't know. Or if my reminder is, my boobs are really sore, is that good or bad? That's your little gong. You're gonna take some breaths or feel your butt on a chair. feel the oxygen going in and out of your lungs, that sort of thing. So just make it big picture, turn it into something that would be kind of clenchy and stressful and fight or flighty into something that's really truly holistic, and you'll be doing great. So every body is different, every pregnancy is different, and if you're on a whole bunch of hormones and you've been on a whole bunch of hormones for a while, you might feel very different than the standard kind of typical what you read on the internet signs of early pregnancy, because your body's been all jacked up on a bunch of progesterone suppositories or progesterone shots and estrogen patches or estrogen pills. And so all bets are off. You might have felt crappy for weeks already, you might feel radically different, you might feel anywhere in between. That is all very, very normal. I want to say just a little bit about nausea and food aversions, because that's one that everybody looks for. In reality, if I had to say what the top 2 earliest signs that I see when I see signs, which I don't always, but when I do, the things that I see are actually feeling really tired and feeling short of breath. Those are the 2 early things. Again, not everybody has them though, so if you don't, that's your bell. You just got to kind of get big picture. But the nausea and the food aversion, those pretty textbook happen if they're going to happen starting around 6 weeks. Now we've established when you find out you're pregnant, you're 4 weeks. So you've got 2 more weeks before you'd start to have some food aversions and some like, I can't think about meat kind of things maybe happening. Again, not everybody has this, especially if you're on hormones, all bets are off. But if you have signs of being really nauseated or really like feel gross, digestively sooner than that, that's totally legit. You really feel it, but it's probably not so much pregnancy. Well, it is, but it isn't. It's not that typical pregnancy kind of hormonal blood sugar issue. It's probably that you're really anxious. So that's, again, another sign holistically that like, oh, I'm overwhelming my digestion with worry and thinking about this and ruminating and obsessing, and it's making me sick to my stomach. So do some yoga, do some meditation, you know the drill. Okay, so here is what is happening in your first trimester. Now, if you're on a bunch of hormones, you might have a bigger buffer getting help from the outside, so you might not feel this, but regardless, this is what is happening. So in the first trimester, the baby is very small, getting a little bit bigger, but the placenta is being formed. And the placenta is a big darn deal. The placenta is basically an organ. From a Chinese medicine perspective, the placenta is a factory that converts whatever is in you and converts it so that it can get into the baby. The healthier the placenta, the healthier the entire pregnancy is going to be. So this is the foundation that sets you up for less preeclampsia, less intrauterine growth restriction, less preterm birth. All sorts of things come from having a better placenta. Now the placenta has to start functioning by around 9 to 13 weeks. And remember, you have 2 weeks where you weren't really pregnant that we're saying you were pregnant. So really in 7 to 11 weeks, your body is going to make an organ and get it functioning. By the time you have your baby, your placenta is about the size of a dinner plate, and it looks like a thick steak. It's kind of crazy. If you ever get a chance to look at a placenta, I highly recommend it. Placentas are one of my favorite subjects ever. So placenta is a big darn deal. That's why you might feel different, because your body's going to take energy from all over the place and put it to your uterus, put it towards making that placenta. Another thing that comes in really handy if you know that this is what's going on is the idea that you have to graze, because whether you're laying on the couch or just in bed sleeping, you are energetically, calorically like running a marathon all day, every day to get that placenta going. So you need to graze and eat really energetically available foods pretty much constantly in the first trimester. So if your body's telling you it needs to eat at least every 2 hours, that's very normal. And if it's craving things that are kind of like simple, fast energy, like carbs, and often with dairy, it's like the body knows what it needs to do the placenta, that's really normal. Quick note, first trimester is not the time to force yourself to eat a bunch of salads. There's lots of cool research on why there's food aversions and stuff that I'll talk about in a different a la carte video. But listen to your body. If it wants carbs and it wants dairy, eat Cheerios and milk. Eat bagels and cream cheese. Eat potatoes and sour cream. Oh, so delicious. Good first trimester food. Let's go on to a more complicated-ish topic. How you might be feeling emotionally, which could be anything. Absolutely anything, and a mix of everything. It could be the highs and the lows and the ups and the downs and the guarded and the excited and the dread and the fear all together. All of this is perfectly normal. Remember, conditions being what they are, how could it be anything other than what it is? You do not need to be positive. You do not need to be excited. Think about that person who was told that her pregnancy probably wasn't viable and was really guarded for a lot of weeks. That's fine. So if you've had a miscarriage multiple times before your first trimester is done, you're probably not going to get excited until you pass those thresholds and get into new territory. That's okay. Don't beat yourself up. On the flip side, this is hopeful. This is a really big deal. A positive pregnancy test, even if you've had a loss before, or even if it's been 8 years to get to this point and you're terrified, is really exciting and hopeful. So allow yourself to try to make that space for both together at the same time without blending the two. Play that game of mental ping pong where you're excited a little bit and then you're like, nope, rein it in. You're guarded a little bit and then you're hopeful. As your conditions change, as things evolve, as you see the heartbeat, as you get further in, as you start to feel different things, you're going to feel different things emotionally too, and that's just normal and natural. Remember, emotional expression is always really healthy, so whatever it is, journal. My son's pregnancy was pretty hard, so I kept a separate journal for like, baby, I'm so excited, I love you, and another one for like, oh, I feel so gross, this is really hard. Get it out. It's healthy. If whatever you feel, that's perfectly reasonable and you should honor that. So let's talk about, oh, I can't believe I'm even going to say this, what you might be worried about, which I realize is pretty much everything. I could spend hours just sitting here listing the things that people have brought up in visits to me. So some of the most common ones are travel, air flight, hair dye, sushi, lunch meat, skin products, let's see, drinking tea, drinking coffee, gardening, symptoms being sick, not being sick, feeling something, not feeling something, worrying about ectopic, I mean, you name it. There's a lot of things that will cross your mind that are perfectly human and perfectly normal. The trick is, if you want to be truly holistic, is not to recoil from them and hate them and feel like you're failing or feel like you're supposed to be feeling something different, but instead to really lean in and to know that no matter what you're worried about, the root of it is that you are attached to this pregnancy. It's a big deal. You've worked hard and that it means a lot. And so even if it's terror, that is rooted in connection and love and authentic big human feelings, and that's what you should feel. So see it as a sign of that and nothing else. Connect to it. It's not about being some transcendent, perfect Zen human being. It's about connecting to being real and human, and that's how it feels to be pregnant in your first trimester after you've gone through a lot to get pregnant. And remember, we would be extinct if you had to feel a certain thing or do a certain thing or not do a certain thing. So most of the things that you're worried about are probably in the we would be extinct camp. So just listen to your body. If it tells you specifically that it's not digging it, then stop. But otherwise, it's probably fine. There's a book called The Panic-Free Pregnancy. I'll put a link to it. And that's a really good book. It has a glossary where you can look up, like, is lunch meat really bad? I mean, guys, you might want to avoid it because it is a little bit riskier or microwave it. But honestly, like, think of all the people all through like the 70s and 80s and 90s that ate lunch meat all the time. And, you know, I'm here. My mom lived on hot dogs because she was really sick with me. I'm here. I turned out fine. So we would be extinct is a really great mantra. And leaning in and embracing whatever you feel is perfect and right, and conditions being what they are, it's like this. One other big thing that you might be worrying about is next visits. As you get to the next, close to doing the next blood work or close to going in to look for that heartbeat, which they're going to usually do shortly after 6 weeks, it's going to be like, okay, I was doing fine, and now it's building, and I'm going to lose my mind. And by the time you get to that waiting room, you're like vibrating and you can't breathe and you are shorting out and you can't really even hear what the ultrasound tech is going to say to you. That is normal. Again, sign that this is a big deal. So ask for what you need, right? So if you've had a loss at 8 weeks and they say, okay, we're going to do an ultrasound to look for the heartbeat after 6 weeks, and then we're going to do another one at 10 weeks, and then we're going to graduate you to your OBGYN, ask for another ultrasound at 8.5 weeks if that's what you need. It's not about the ultrasound making or breaking anything, but it's about you being truly holistic and asking and advocating and getting what you need to tip your scales. Now, if what you need is an ultrasound every day, then you're gonna think, is that a realistic request and how can I work on that? So maybe there, if that's what it feels like you want, maybe a better fit would be, I think I should go to a group for anxiety in early pregnancy or start seeing a therapist. And I can still ask for one extra ultrasound or talk to my doctor about how I can get in contact with them easier or things like that. But you wanna do things that overall honor your reality in a, reasonable way. And then think about foundation ideas, right? So I'm freaking out thinking about that appointment in 2 days. And so I just really need to sit here and think about 3 things that I can hear and think about the temperature of the oxygen as it's coming in my nostrils and leaving my mouth, and do some nice breathing exercises. Or I need to just sort of lay in my bed and feel where the sheets and the blankets are pushing on my body. Do those foundation ideas. Think about offsetting and tipping your scales. Think about breath. Think about gratitude. Think about all the things you're learning in this program. It's not about getting rid of the worries. It's about keeping them in check and working with them and having a different relationship with them. And that's exactly what you can do as you're worrying about these visits. One little note about visits, I mentioned that they're gonna look probably for a heartbeat. It starts around 6 weeks. It's a little safer because it's a little kind of iffy there. If you wait a few days beyond, then you're more sure to see something that's, a real reflection of what's going on with the baby. If the embryo has a good heartbeat that's in the range that they're looking for, which you can ask your doctor about, and it is measuring on track on that ultrasound, then at that point, and this is with just general pregnancies, not genetically tested, which would be lower, but at that point your miscarriage rate goes down to 3% actually. So a lot of people are waiting, thinking about the end of the first trimester, but reality is that seeing a heartbeat visit is a really big deal. And then at the end of the first trimester, it goes down to about a 2% loss risk. So big deal. All I know is that I don't know also still applies because there are some losses post that, and if you've had one, honor that. But that is a really big deal to make it to that step. Okay, so why does big picture matter? Hopefully by now it feels intuitive and you know that it is, but let me just reframe and remind you of why the big picture really matters once you're pregnant and why you should keep on doing the rest of this program, because there's going to be a ton of stuff that still applies just in slightly different ways. So it's not about making or breaking a pregnancy. I promise you there is nothing that you will do that will in one fell swoop make or break a pregnancy. Think about cancer patients. You wouldn't tell them that if they drank an extra cup of coffee, it would make or break their cancer diagnosis. Same thing applies here. But small and cumulative do matter, and it matters for your quality of life, it matters for your mental health, it matters towards moving towards abundance or towards scarcity, and it matters for the setup that you're giving your baby in utero. Remember, you can't give what you don't have. So the more that you have, once you find out you're pregnant, you're gonna keep on putting it into your pregnancy, into your baby, into your holistic bank account, and everybody is gonna do better. So keep it up. Don't say mission accomplished and I'm done with this. And a reminder, epigenetics is real. So if you spend your entire pregnancy freaked out and not thinking about the big picture and just like, oh, now I'm worried, you're gonna be wiring your baby in utero for being less resilient when it comes to stress and stressors. So it's, obviously don't feel bad if something terrible happens and you're stressed out. That's legit and you can't help that. And there are plenty of things that you can work with your kiddo to help them cultivate resiliency after they're born too. But if in general, your pregnancy is going pretty well, but you're just spending it freaking out because you're not staying big picture and you're just sort of like thinking about future thinking and past thinking and spiraling and freaking out, that's not gonna be as good of a setup from an epigenetic perspective for their stress coping strategies and abilities. So think about that, honor that, and keep working on the big picture. All right, so we're getting close to the end. I just want to say congratulations. It's like this now, and there's reason to be hopeful and excited. And if you can't feel that, again, it's okay, but I just want you to know that I'm out here feeling it for you and holding that, and when the time is right and you can feel it, you're gonna get it too, and that we're in this together and I'm with you. So you're not alone, and I'm so excited for you, and I'm so happy that you're watching this video. So keep watching more videos, stick with the big picture, and I'm gonna leave you with a new mantra to add to the mix. So the mantra is, I trust you. And what I like about this mantra is it's not overly positive or overly negative. It's just, I trust whatever it's gonna be, whatever it can be, that's what's gonna happen. And it could be to your uterus, to the baby, to the universe, to a higher power, whatever feels right in your heart and your soul. It's not being falsely optimistic or pessimistic. Other mantras, I've said them throughout this video, but let me repeat it. All I know is that I don't know. Say it over and over 1,000,000 times. We would be extinct if it was about, you know, you had a little bit of blue cheese accidentally and nope, you're done. We would be extinct if it was about lifting up a laundry basket or a kiddo that you already have. We would be extinct. Think of those pioneer women. So remember that. A last reminder. Don't go on the internet if you can help it. Watch these videos, get some good big picture books. I have a couple of recommendations that I'm gonna give you in a second, but just stay the course with being truly holistic. Don't spiral into researching stuff. Just stay focused on tipping your scales and you will do so much better, and it will be good in so many ways. Here's what we covered in this video. HCG basics, high, low, what that means, doubling patterns, what that means, what you're looking for, and more. We also covered how you might be feeling physically, could be anything, emotionally, also could be anything, and we covered both emotionally about general stuff and next steps. We also talked about why the big picture matters. Hopefully you already have that, but just a nice little reminder of how it absolutely applies to pregnancy, even in this new stage, in this new phase, and I gave you a new mantra. Couple other new things. Babymed.com is a website that has a super comprehensive page about HCG levels. So if you're having wonky HCG things or questions about your HCG, that's a decent resource, although you could stay big picture and just say, all I know is that I don't know, and take it one step at a time, and it won't change. So you could do that too, but if you must, that's a resource. I have a couple of favorite books that I use in my clinic a lot, so oldies but goodies. The first one is called The Mindful Way Through Pregnancy. It's a compilation of meditations and yoga and journaling, and it's compiled by a woman named Susan Piver, and it just has the most lovely essays and ideas. One of them in particular is by a woman named Ann Cushman, who suffered a stillbirth of her daughter, I believe. And she just has the most beautiful way of talking about riding those waves of feeling guarded and feeling hopeful and a mix and being really human. So I recommend that book. And then my other favorite book is these weekly meditations for pregnancy. It's a week by week kind of pregnancy book, kind of like what to expect when you're expecting, only not terrifying like what to expect when you're expecting, which can be truly terrifying. So it just has like a page, a tiny little page about what's going on that week, some things to think about, some holistic ideas that go with it. It's not overwhelming. It's nice. It's grounding. It makes a pregnancy feel a little bit more real. If you feel nauseated or have questions about food and eating, there will be an a la carte video coming out about that. If you have bleeding in pregnancy, there is an a la carte video about that. It is super common to have some bleeding in pregnancy in general, way more common than what you know, and especially if you did IVF. I had one clinic tell their patients that about half of their IVF patients bleed in early pregnancy. I'll say this right now here, over 50% of the time, it's not the end of a pregnancy. So if you bleed, go watch that video. If it's not too severe, obviously. If it's severe, you want to go in right away. One last little tip before I leave you. A lot of women have heard a lot of things about pregnancy symptoms, but it's surprising to me how few have heard of a thing called round ligament pain. Round ligament pain is something that happens usually around week 10-ish, so you're getting towards the end of the first trimester. But if you basically think about all the ligaments in your pelvis and your uterus being in the middle, as your uterus is getting bigger, it's gonna kind of get hung up and it's gonna twang like a guitar string on those ligaments. And so if you're, usually it's with a position change, so you're getting up out of a chair or you're rolling over in bed and all of a sudden it's on one side usually at a time, because it's one ligament that's getting twanged, and it's sudden and it feels real twangy and intense. A lot of times people are gonna freak out and think that they're having a cramp or they have to be real hypervigilant. That is actually a really good sign that your uterus is expanding and things are happening how they should. So file that in the back of your brain for hopefully in a handful of weeks from now, and know that round ligament pains are a thing and that they're very normal. Guys, I'm gonna get misty over and over and over, but I know that I only know you through a screen, but just knowing that someone is watching this video, knowing that you are watching this video makes me so happy. Send me a message, let me know how you're feeling, let me know if this video is helpful. I hope that this video added extra layers of feeling informed and empowered, and that you can stay really big picture and truly holistic. And remember that it is like this now, and this is really hopeful and exciting. Be well, I'll see you soon.